Okay, so what we want to do is do a little demo on how to set up a distal limb cryotherapy on a horse to prevent laminitis or laminitis prevention. First of all, you want to look at the foot, and how we prepare the foot is going to depend on each specific case. Sometimes the best thing is barefoot. If the horse is well shod, you may want to just keep the shoe on, but each case is going to be a little bit different in terms of hoof preparation. What we use to protect the horse's foot while he's in ice are these soft ride boots with a foam, rubber, very resilient pad. There's a number of different products that you can get to do this. The soft ride boots actually come with a rubber pad in them. So put this on to give the horse a really soft, resilient base of support. Stay on pretty good. And then we want to put a layer of elastic on the forearm here. This is so that when we change the water and the ice out, we're not repeatedly pulling on the hair and the skin of the forearm, so we don't irritate the skin, because we're going to have to change the elastic here many times. Just one layer of elastic. Then we use a waterproof, durable bag. We use a product from Grand Circuit that comes with the Clean Track soaps. And just about any kind of a durable waterproof bag should work as long as it's not too bulky. Put that in there. Now we want to fill ice to approximately the level of this fetlock. If you get much more than that, it's a little too heavy and a little too cumbersome for the horse, and a little bit less, you're probably not going to cover what you need to cover. We want to secure the boot with a layer of elastic on. You want to make sure that you don't get a tight band in this area, because we don't want to make a tourniquet. We want to avoid any really concentrated areas of constriction, because we don't want to form a thrombus either. Horses tolerate this cryotherapy really well, and in most cases he's going to be in ice for 72 hours. There you go. So when you want to kind of monitor the ice in here, and we don't want to let it melt completely, because we want to maintain a temperature just above freezing for the distal limb. So when it's time to change this, when the ice has melted, you can just pull this off. Maintaining this lower layer. This time this will be all water, or mostly water in here. Pump that out, put his foot back in, and recharge it with ice. And on the hind limbs, similar story, but many horses won't tolerate ice on the hind limbs, so that's going to be on a case-by-case basis. Sometimes they won't stand for it, so you're going to have to just experiment with the horse that you're working with. Oftentimes, in terms of laminitis prevention, the best thing you can do is just a soft ride. So you're going to either cut your bag or fold it down. Like I said, many horses won't tolerate this, especially standing in the stall. But you're just going to have to work with your individual patient and find out what he can